Good afternoon. Welcome back to the Press Box here on Sports Radio 1450. I am Adam Stark alongside Casey Becker, Ryan Hickman running the show back at the studios. 529-1450 is our phone number. We're live at the Illinois State Fair at the Shed, right across from the Carnival Midway. Carnival Midway and the Shed, we're in the northeast corner of the fairgrounds if you want to come see us. Plenty of food, plenty of cold drinks. We have a local Reich Gold Top beer out here from Springfield. Have you tried that, Casey?
I did on the parade day, right after the parade run.
Well, the Springfield Illinois State Fair here at the Shed is brought to you by the Springfield Clinic Orthopedics Center, walk-in located on 800 North 1st Street. And we actually have Dr. Diane Hillard Sembell here alongside of us. Good to meet you. Heard the name 1,000 times with your advertisements and stuff, and you're sponsoring us. We appreciate that. Good to see you.
Thanks for asking me.
And
I know this guy.
Apparently you've seen him before.
Yes.
Tell us about it.
Well, I was actually a patient of Dr. Dye. In my senior year of high school, I had a really tough battle with knee tendonitis, my patellar tendon. I was having some real bad tendonitis. I saw Dr. Dye twice a week. We did ultrasound. We did stretches and exercises. And I only got to high jump 4 times my senior year because it was so bad. So we just saved my performances for the really big meets. But because of your treatment, I was able to defend my state title. Well,
and then you went to K-State.
Great athlete, yeah. Still is.
So I know firsthand. We don't need to sell you anymore. You've already sold me. I experienced it, and we know that you've helped. We were talking 27,000 people possibly.
Well, you've been doing the math. 27 years. Now, I started when I was 12. Remember that. So I'm only 39. But
fair enough.
No, 27 years in practice. So I don't know how many patients have come through the door. You know, we should do that math sometime and figure it out. But.
Well, tell us about the Walkin Clinic, though.
So Springfield Clinic Sports Medicine and Springfield Clinic Orthopedic Department, we have a walk-in clinic that's available every day from 7 a.m. till 6 p.m. And then on the weekends we have Saturday morning hours as well. So people don't have to have an appointment. A lot of times it's an acute injury. It may be something where they just for convenience don't want to have to make appointment and wait. Mm-hmm. It can be anything from arthritis to sports injuries to chronic problems that they just need to get taken care of. So generally, from my perspective, the non-operative sports medicine people in our group will be in the walk-in clinic, and I'm right down the next hall. So if somebody needs to see me, then we can get them in. Other people, they can call my office, and we can usually get them in a day too. But if they want to do the walk-in clinic, technically that's in a special location. We have 6 physicians and several PA nurse practitioners, so we've got a lot of people that work that clinic.
We were talking off the air about how it seems like there's been a lot more ACL, MCL, PCL injuries recently. It seems like those numbers are going up. You said something like 200,000. 1, why do you think those numbers are going up? And 2, what can younger athletes do to prevent those types of injuries?
Yeah, great question. The 200,000 per year in the United States only comes from some like 2016 data. And actually, I just got back from the American Orthopedic Sports Medicine Society meeting, and they're estimating that it may be close to double that now. And if you look at a lot of it is there's increased participation from very young athletes to senior citizens. A lot more people are participating. And I know you talked to Dr. Western just a couple days ago, or maybe even yesterday, about the fears of youth sports, and we don't really want people to specialize so young because that is actually not good for the joints, not good for balance and strength, and the coordination that comes with a variety of sports. So number one, that may be a factor. When it comes to female athletes in particular, there's anywhere from 4 to 8 times more ACL tears and even other knee injuries that happen. If you take the same athlete, male, female, put them in the same sport, the same number of hours, that female athlete is going to have anywhere from 4 to 8 times more chance of injuring the knee. Several factors that come into play there. Again, training, some things we can change, some things we can't. The one thing we're really focusing on in our injury prevention is neuromuscular training, because we've found through lots of research, international research, has found that hip weakness, and when someone lands, if they land kind of in valgus with knock knee position, that is universally bad. It may be their ACL, it may be their MCL, it may be even patellar problems, kneecap, patellar dislocation, but that position is very dangerous. So focusing on hip strengthening, hamstring strengthening is very important. A lot of times if an athlete is what's called quad dominant, their quadriceps are proportionally too strong in relation to their hamstrings. That can also be dangerous, So looking at balance training, getting with a coach, an athletic trainer, a personal trainer, and really looking at the mechanics, not just going through the motions and over and over and over and training the same sport over and over again is not a good thing.
We want to remind you the Shed Sports Barn is brought to you by Springfield Clinic Orthopedics Walkin, located at Springfield 800 North 1st, providing comprehensive evaluation and treatment of sports injuries, workplace accidents, and other acute injuries that require immediate attention. Doctor, when I did get into college, there were a few times, like a handful of times, where I got a cortisone shot in that same knee to compete at some of the bigger meets. That was a lot more common. Why don't we hear about the cortisone shots as much anymore?
Well, cortisone injections can have detrimental side effects. At a collegiate level, back in the day, they may have been used a little more frequently. But we really want to get a more natural way of decreasing the inflammation and getting at the root cause. Why is it happening? We don't want to just mask the problem. So cortisone may be a great treatment for other things, such as arthritis later on, and not later on, but for older people with arthritis. But for an acute injury, not used. And sometimes you see those old movies, documentaries, where they take them in the training room. No, that's not what we're doing.
Right. I do want to bring up a knee injury that's kind of taken center stage in the sports world recently. Klay Thompson of the Warriors suffered an ACL in the NBA Finals. Now, he has a reputation of being a super healer. He overcomes injuries like half the time that most players do. Realistically, with the right training and recovery and treatment, how soon could he expect to be like a super healer? What's the quickest? They say 6 months, but for someone like him, is he able to heal a little bit quicker?
Well, biologically, no. He doesn't heal any faster. And I've used examples of other professional players to my patients, and I say if you're getting paid millions of dollars per game, they may take a little chance and stretch that envelope. There's a healing window. And typically it's 5 to 6 months to get back from an ACL injury. But there have been pros that get back in 3 or 4 months. They're at risk when that happens. And there was recently a study, again, the Sports Medicine Society just a month ago, showing with young adolescent athletes the rate of injury, if they go back before 8 months, was much higher. Every month after 7-8 months that they delayed their return to sport, they had a markedly decreased re-injury rate. So that's for the young adolescent ACL athlete. That doesn't correlate to the collegiate and pro. But
Gotcha.
So there's a lot of factors. But there is we say the biologic envelope. We have to respect the healing. So we can push it and we can get them in great shape, get their strength back, get their flexibility, get their speed and agility and balance. But they have to not only have the time that's gone by, but also pass 95 or more % functional testing. When we look at how they land, how they move, we want to make sure they're really, really ready.
I would say that the term favorite injury is almost creeping into the oxymoron level. It's not a healthy injury, but it's almost oxymoronic. What is your favorite injury to diagnose, sports-related knee injury? What is your favorite one to treat?
Well, they call me the knee lady, so and I pretty much do knees now. And I do love to do an ACL surgery because there's so much technique and there's so much I say strategy, I don't know. It's so rewarding to get somebody back from that injury, which used to be 20, 30 years ago, that was career ending. Now it's not career ending. It's season ending in most cases, but they can be back. I've had people go back, college, scholarships, even beyond. So you can come back, and that's what's so rewarding because you take something that could be devastating. And the other thing that's rewarding is I've had a lot of athletes that it's become sort of their pathway to be a physical therapist or an athletic trainer or some field in sports medicine because they took something bad and learned so much about it.
Oh, I would love to do that. I just don't have the brain capacity to. So, I mean, I would have loved to have done what you did, but,
but you
I'll
were
talk about sports.
Collegiate athlete, so.
Well, you said your son's pre-med, though, right? Is he following in your footsteps, or is he doing something different?
He's not sure exactly what specially, but he played football at Rochester High School and went on to Ball State. He played 1 year there and decided to focus on not just academics, but number one, academics. And he's doing well. He just took his MCAT, and he's going to be applying, and we'll see what happens.
I think Casey just saw Coach Leonard.
Coach Leonard is here. We might try to get him on here in the last segment.
We'll try to snag him.
I understand that you work with Rochester football a little bit.
I am. I'm their team physician.
Okay, great.
Yes.
That's awesome.
Thanks.
How long have you been doing that?
I started about the time that Evan was getting into high school. I had done another school prior to that. Another Leonard.
Okay. Well, you helped Di Vernon back in the early 2000s.
Yes, I mean, I've taken care of athletes from so many schools, but when Evan got into high school, we had a discussion and we decided to, switch our location of resources, and I switched and covered Rochester pretty much full time. But like I say, we see athletes from all the area schools, and there's no favoritism when it comes to sports medicine.
Well, one last question though about the ACL. Obviously, you call it your favorite, but that's because you probably have done that the most. Why? You kind of touched on that a little bit earlier, but why does this happen more frequently now, and what sports, and is it because they're starting as adolescents?
Well, I think that subspecialty training, again, at an early age, is not a good thing. It should be athletes that participate in many sports. There's also people are bigger, stronger, more forces. So contact injuries, we're not going to be able to control those. Non-contact injuries, though, we need to continue with our efforts to do prevention, do strengthening, balanced, focused strengthening for the hips. Look at not just how much can they squat, how much can they lift, but how do they move? And so that a lot of the times it's non-contact. They plant and they cut. And even R.J. Griffin, there were clips of him, RG3, in his pro camp where they showed him doing his jump for distance, and he landed. And guess what? He had an ACL tear, and he was Washington Redskins, professional athlete. So
he was one of the best track athletes in the world, actually, too.
Yeah,
he was a hurdler. Yeah,
amazing speed and strength. But did he land correctly? Not always. And
right. Well, I guess that's why I'm asking that question. So it's not as much the physicality like being a football player, but it's more of the stop and go and soccer and basketball.
Yes. If you look at the sports, the number one non-contact. Female soccer, female basketball, and then, of course, football. Like I said, the contact we can't control, but a lot of times they give a history. I went to plant, and I went to change direction, and when I went that way, I felt and heard a pop, and there was nobody there. There was no contact.
Yeah.
And so and you can't control everything. Accidents happen. I mean, sports do have injuries, but we want to work and really do what we can in the off season and even during season to make sure they're doing everything they can.
Well, injuries happen. We appreciate that you're the knee doctor, Dr. Diane Hillard Sembell with the Springfield Clinic. We appreciate you stopping by. We could talk to you for hours, but it was great to meet you face to face.
Yeah, good to see you.
Definitely heard your name. We appreciate it. We are here at the Shed at the Illinois State Fair. It's the Press Box on Sports Radio 1450.